In the last sketch, we took a terrifying journey into our repressed childhood memories at Zany Zankers, where we discussed some of the more annoying pathologies of the upper and lower esophagus, including the big one, GERD. And while GERD may be annoying enough, its transformation to adenocarcinoma is, well, downright soul-chilling. And if you thought the nightmare of macabre malfunction mechanical mammals was over and that the healing could finally begin, well, unfortunately. In this sketch, we'll venture bravely through the bowels of an animatronic animal to discuss malignancies and motor dysfunction of the esophagus. First, we'll continue with the GERD theme and take a look at adenocarcinoma. Then we'll cover squamous cell carcinoma of the esophagus, which is associated with even more terrifying risk factors. Beetle nuts, beetle nuts, beetle nuts! And after that, we'll wade through the mire of some of the mechanical disorders of the esophagus, including Plummer-Vinson syndrome, achalasia, diffuse esophageal spasm, and crust syndrome. All of these disorders cause the same presenting symptom, dysphagia, or difficulty swallowing. So we've brought back that old stage acting trope, the vaudeville hook, right to the throat. As we prepare for the next act, you're going to get a behind-the-scenes look at dysphagia caused by tumors, webs, motor dysfunction, all kinds of stuff. The key here is to think about the other signs and symptoms that characterize the dysphagia. Is it progressive, first affecting solids and then liquids? Is it associated with pain? What does imaging show? Let's get the worst diagnosis out of the way. Esophageal cancer, which can be adenocarcinoma or squamous cell carcinoma. To the left of the curtain, we're going to illustrate adenocarcinoma, the most common esophageal malignancy in the US. It tends to occur in older people and is 7 times more common in men than women. The adeno part of adenocarcinoma means you'll see gland-like features on histology, of course. So we always try to include some kind of gross-looking glandular stuff. Kind of like the stuff and fluff popping out of the animatronic bear out on stage. I guess it's some kind of off-Broadway Goldilocks, or Five Nights at Freddy's, maybe? Wait. I recognize those haunting, lifelike eyes. That crusty, poorly maintained exterior. It's the Barrett's bear. Barrett's esophagus is the cause of pretty much every case of adenocarcinoma of the esophagus. Recall from our Zany Zenker sketch that Barrett's results from chronic GERD. The normal stratified squamous epithelium of the distal esophagus undergoes metaplasia. It's replaced instead by columnar epithelium, similar to the mucosa of the intestines. That's called intestinal metaplasia, represented, just like last time, by those metal intestines, popping out of his empty, lifeless shell. Pretty disturbing, actually. Though, as you know, at Sketchy, we're all about remembering stuff. And what's more memorable than something you wish you could unsee? As metaplasia continues, the cellular genome accumulates mutations, causing metaplasia to progress to dysplasia and, eventually, invasive adenocarcinoma. An interesting contributing factor to this phenomenon, especially in patients with pre-existing Barrett's esophagus, is smoking. Another good reason to talk to your patient about smoking cessation. Let's highlight the bottom of the curtain, because adenocarcinoma most commonly affects the distal third of the esophagus, including the GE junction, which makes sense when you think about where all that metaplasia and dysplasia occur in the setting of chronic GERD. Cancer can even develop more distally, in the gastric cardia. Remember, the overarching motif here is dysphagia, or difficulty swallowing. Esophageal cancer usually causes a progressive dysphagia, initially for solids and then for liquids. Think of it this way. When a mass sits in the esophagus, big solid chunks get caught first. But as the mass gets bigger, even liquids have a hard time. Way in the back, we've illustrated the early stages of disease, when solids get stuck, but liquids pass on through, as depicted by the theater patron's rotund mass of a body getting caught in the aisle, while he inadvertently lets his drink fall right on through. Remember, though, as disease progresses, even that drink won't make it through. As the dysphagia gets worse, patients just aren't able to eat like they used to, resulting in weight loss. Patients may also experience a retrosternal discomfort or burning sensation, as well as pain with swallowing, also called odynophagia, kind of like a hot bite of pizza sliding down that esophagus. Slow down there, buddy. Unfortunately, by the time these signs and symptoms become apparent, the cancer is usually pretty advanced. Because of its aggressive nature, late presentation, and early spread, the 5-year survival rate for patients with esophageal adenocarcinoma is only around 25%, even with aggressive chemoradiation and surgery. While adenocarcinoma is the most common cause of esophageal cancer in the United States, squamous cell carcinoma continues to be the most common esophageal malignancy worldwide, though incidence varies quite considerably between geographical regions. The highest rates of squamous cell carcinoma are found in an area dubbed the esophageal cancer belt, which includes northern Iran, Central Asia, and north-central China. It's not entirely clear why rates are higher in these countries, but a few factors might be at play, usually involving poor nutritional status plus some kind of esophageal irritant. To see what kind of irritants I'm talking about, let's head over to the craft services table. Take a look-see, Oh, here we go. Man, they brought out the good stuff. Is Matthew Perry on set or something? No. Is it Katie? Wait. Luke? Ugh, frickin' Luke. He's like my favorite Perry. No wonder they brought the spread of delicious preserved meats. Hold on there. No touchy. That's for Mr. Perry. Not to mention that a big risk factor for esophageal squamous cell carcinoma, in Asia especially, is the ingestion of foods containing N-nitroso compounds, which include certain pickled vegetables and preserved meats. What else is on the menu? We've got some hot tea. Really hot. Though, I'd avoid that too, because ingestion of really hot beverages and food can contribute to the development of esophageal squamous cell carcinoma as well, probably due to direct mucosal injury. In Iran, for instance, consumption of really hot tea has been shown to significantly increase the risk of cancer. So let's see. What else is... here's an exotic one. Betel nuts, also called the areca nut. This is a popular chewable nut throughout Asia that has certain vasoactive and psychoactive properties. And, wait for it, you know it's coming. Yep. Chewing betel nuts has been linked to the development of squamous cell carcinoma of the esophagus. In the US and Western Europe, cigarette smoking and alcohol consumption are the most common offenders. Also in the US, it's 4 to 5 times more common among blacks than whites, a disparity that can't be fully explained by differences in smoking and drinking habits. Unlike adenocarcinoma, SCC is most often found in the middle third of the esophagus. Aw, why aren't you the cutest little thing? With a little tutu right in the middle. Nice and snug. Like adenocarcinoma, patients with SCC of the esophagus present with progressive dysphagia. In other words, yet again, we're dealing with solids getting caught first, where liquids are impeded in more advanced stages of disease. And there can be chest pain as well, along with odynophagia, or painful swallowing. Watch it there. The sign clearly says that it's hot. Dysphagia eventually leads to weight loss as well, hence the thin physique. A little too thin. You look like a White Walker or something. All right, you remember those Barrett's bears? Herniating glandular stuff and fluff? Adenocarcinoma of the esophagus tends to form exophytic masses. Those penetrating eyes. Almost like he's trying to tell us something. Ugh. No. Moving on. Sorry about that. Eerie. Anyways, squamous cell carcinomas appear a little differently, usually plaque-like thickenings with ulceration. And that's why we've made the tablecloth have the same pattern as the floor, to make it look like a raised flat area. A plaque, if you will. Histologically, esophageal SCC demonstrates flattened polyhedral or ovoid epithelial cells with eosinophilic cytoplasm, and those classic keratin pearls with intercellular bridging common to other forms of squamous cell carcinoma. Unfortunately, squamous cell esophageal carcinoma has a similar prognosis to that of adenocarcinoma, with a 5-year survival rate around 25%. All right, we're going to continue our theme of dysphagia with dysmotility disorders, pathologies that inhibit the normal mechanical function of the esophagus. First up, Plummer-Vinson syndrome. The most important thing you need to remember about Plummer-Vinson syndrome is its cause: chronic iron deficiency, as depicted by the plumber's iron tools falling to the floor. Plummer-Vinson is characterized by the very specific triad of dysphagia, iron deficiency anemia, and esophageal webs. The distinctive esophageal webs seen in Plummer-Vinson are thin protrusions of the esophageal mucosa, most commonly found in the upper third of the esophagus. So in the cross-section of the pipe, notice that we've only made the inner mucosal layer projecting inward. These esophageal webs cause dysphagia